Vernon Johnson. I'm the CEO of Dale Medical Center in Ozark. We are classified as a rural hospital in a medically underserved county, serving Dale and surrounding areas. When you speak of Medicaid, oftentimes people think that it does not apply to them or they're affected by it if they don't have coverage by it. That's a very common misunderstanding. But it does affect all of us within the state, as it is very vital in sustaining the health care services of every Alabamian in the state. Any changes to this program resulting in cuts in payment to any of the providers will affect access of care to all Alabamians. The dollars that Medicaid pays providers for caring for Medicaid patients support personnel, equipment, and the overhead costs that ensures all have access to care. In many rural areas and inner city hospitals, the doctors and the hospitals treat Medicaid patients, and what money they receive for treating those patients, if that goes away, they may not survive if that volume wasn't there. Today, Alabama began to cut those Medicaid payments to providers, and the impact on Alabama's care is going to be affected. These cuts are devastating and they're dangerous. As a result, the doctors across the state and hospitals across the state have some very tough decisions ahead of them. You've already heard where staff are already being cut. They're being laid off. Decisions are being made to accept fewer patients. As a result of that, you're going to start learning of ERs being overloaded because they can't get in to see a primary care doctor. So we're going to start seeing ERs backed up, which is going to create another crisis. And in some cases, you're going to hear physicians closing their practices. You know, we were successful this past year in January, as you've already heard, where we were able to work with the Dothan Pediatric Group in opening up a pediatric clinic in Ozark, and we opened up Ozark Pediatrics. We didn't have a pediatric clinic in Ozark to serve the Dale County community. There were plans to break ground in May to build a pediatric clinic to serve Dale County and the surrounding area. And when the budget didn't meet, we postponed that groundbreaking in hopes that the legislation would step up and we would meet budget. Well, as of today, budget hasn't been met, still haven't broke ground, and now the future of Ozark Pediatric is kind of up in the air. And we don't know what that future will hold as we see how this unravels. So what does that mean? Well, this, I think, kind of leads into the future when communities now can no longer recruit specialists into the state or into their community to provide services. We can't recruit doctors in, much less retain them. It's going to create more crises throughout the state as well, and that we can no longer provide the care, and hospitals can't get what they need into the communities to provide care for their people. And that's going to affect quality of care as well as jobs and opportunities, and it just dominoes from there. So this combined with all these changes will make it much more difficult for any patient in the state, including those on private insurance, those that have that Blue Cross Blue Shield card in their pocket, to get an appointment to see the doctor of their choice at a time that's convenient for them and of their choosing. It's going to be even more difficult for them to get that appointment. So I think it is very vital to protect the state's already very fragile health care system from a total collapse, to ensure that all Alabamians have access to the doctor, that the legislators must find a long-term, sustainable solution to fund Medicaid. And they've got to shore up funding for this coming year. They must go back and fully fund for this year as well Medicaid. We encourage everyone out there, please go on IamMedicaid.com and contact your local legislators and ask them, please fund Medicaid fully and go back and fund this year fully before we create a real crisis in the state. IamMedicaid.com, and let's keep our health care system intact. Thank you.